Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bytes, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's talk about non-hormonal treatment options for hot flashes and night sweats, which we call vasomotor symptoms. Some of you can't take menopausal hormone therapy because of certain health conditions like hormonal cancers, heart disease, active liver disease, or clotting issues. Or maybe you missed the opportunity to start them if it's been more than 10 years since your last period, or if you're over the age of 60. Or maybe you just don't want to take hormones, or you had side effects when you took them in the past, but you're still having disruptive symptoms that you want to manage. So what options are available to treat hot flashes and night sweats if you don't want to or can't take menopausal hormone therapy? We usually break this down into broad categories: mind-body techniques, non-hormonal prescription medications, and supplements. So let's take this one by one. Mind-body techniques are ways of using your thoughts, emotions, and awareness to influence your physical health. Think of practices like meditation, yoga, or deep breathing. They help connect your mind and body to reduce stress and promote well-being. Now, there are two mind-body techniques that have been shown to be effective in treating vasomotor symptoms and are recommended by the Menopause Society. They are clinical hypnosis and cognitive behavioral therapy, or CBT. Clinical hypnosis is where a trained therapist guides you through deep relaxation and personalized guided imagery to help relieve your symptoms. Cognitive behavioral therapy is a type of talk therapy that helps you identify and change negative thought patterns and behaviors to help you manage your symptoms. You can usually find a practitioner of these approaches in your community, but if you prefer a self-guided approach, there are self-guided hypnosis and CBT books. I particularly like the cognitive behavioral therapy one called Managing Hot Flushes and Night Sweats by Myra Hunter and Melanie Smith. These are authors of several of the CBT studies out of the United Kingdom. You might have heard that certain other techniques like acupuncture, exercise, or certain breathing techniques can be helpful for vasomotor symptoms. They are no longer recommended by the Menopause Society due to lack of studies showing that they are effective in treating hot flashes and night sweats. However, they can be an important part of overall health and well-being, so if they work for you, that's great. In terms of non-hormonal prescription medications, there are a number that we use to treat vasomotor symptoms. Remember that hot flashes and night sweats stem from the level of the brain, and there are a number of medications available that work at the level of the brain and reduce hot flashes and night sweats. Most of these are off-label use, meaning that the medications themselves were actually developed and FDA approved to treat other issues, but they've been found to be helpful for hot flashes and night sweats. These non-hormonal prescription medications are usually used at lower doses, and they reduce the severity and frequency of hot flashes and night sweats, but they don't make them go away altogether. They usually reduce vasomotor symptoms by up to 65%. So these are the medications. First, SSRI, SNRI medications that are used to treat depression. These are medications like Celexa, Lexapro, Paxil, and Effexor. Paxil is the only SSRI that is actually FDA approved to treat vasomotor symptoms. They all can have some sexual side effects, just so that you know. Next, gabapentin is a medication that's used for seizure disorders, anxiety, pain syndromes, and insomnia, but can also help with hot flashes and night sweats. It can be dosed 3 times a day, but sometimes we only dose it at night because it can cause drowsiness and help you with sleep as well. Oxybutynin is a medication we use for overactive bladder and urinary incontinence. It's also available over the counter at lower doses, and it can cause some dryness symptoms. We don't recommend using it in women with dementia or those over the age of 65 because it can increase the risk of dementia. And then finally, medications like Veozah, which were recently FDA approved, are a newer type of treatment that target the brain's temperature control center to help reduce hot flashes and night sweats. Side effects can include abdominal pain, diarrhea, and insomnia, and rare but serious liver injury. So we now do liver function testing when you're using these types of medications. In the past, there have been other medications like clonidine and trazodone that were prescribed to help with vasomotor symptoms as well, but these are no longer recommended to treat hot flashes and night sweats by the Menopause Society due to lack of data showing that they actually work. When it comes to supplements for menopausal symptoms, most major OBGYN organizations no longer recommend them due to a lack of proven benefits, a strong placebo effect, and safety concerns because they're an unregulated product. I know this might be disappointing to some of you, especially if you're actually taking supplements and feel like they're helping you. If something seems to be working for you, that's great. But be cautious. Supplement companies make millions and they aren't likely to fund studies that could show their products don't work. Plus, without regulation, you can't always be sure that the product you're getting is safe. If you are using supplements, I recommend checking them out as much as you can. Make sure to use only USP-verified products or go to consumerlab.com to make sure they are as safe as possible. So that's it for another episode of Menopause Bytes. Here are some take-home bites to remember. Not everyone can take menopausal hormone therapy to treat hot flashes and night sweats, and there are non-hormonal options that have been found to be helpful. These include mind-body techniques like clinical hypnosis and cognitive behavioral therapy, as well as non-hormonal prescription medications such as SSRIs, SNRIs, oxybutynin, gabapentin, and the new medications like Veozah. Supplements are not recommended to treat vasomotor symptoms due to lack of studies showing that they actually work and lack of regulation, which leads to serious safety concerns. Until next time, may your hot flashes be bearable, your nights restful, and may your courage never waver.